Surprise! Drinking water wrongly can damage your kidneys. When we say wrongly, it means you might end up drinking either too much or too little water. Both have the potential to damage your kidneys. But what's the correct sum of water to drink? Many people believe in the old adage that one should drink 8 mugs, or approximately 2 liters of water every day, to remain hydrated. This misconception arises from the confusion between water intake and overall fluid intake. Water intake refers to consuming water, while fluid intake includes all beverages and foods that contain water. When we talk about keeping yourself hydrated, it's not only about drinking plain water but also about everything you consume. That's why the advice to drink 2 liters of water every day isn't necessarily accurate for everyone. Simply drinking plain water may not be enough. Next, we will explain in detail how consuming either too much or too little water can have negative effects on your kidneys. Before we dive in, please note that all the information in this video comes from real people, thoroughly fact-checked, impartial, and reviewed by qualified experts. Drinking too much water. Whereas specialists are still deciding the right sum of water needed day by day, consuming over 1 liter or nearly 1 quart per hour will put extra strain on the kidneys. As per the Merck manual, an estimate indicates that repeatedly consuming more than 23 liters or 24 quarts of water within 24 hours may result in excessively high water levels in a healthy young adult with normal body function. Your kidneys usually filter out excess water, so there's no need to worry. Water toxicity, overhydration, water intoxication, or excessive water consumption rarely occur in healthy individuals. People at risk of overhydration are endurance athletes, premature babies, and people with specific mental illnesses and pituitary disorders. Water intoxication may also occur in those with kidney, liver, and heart disease because of their limited ability to maintain proper fluid balance. People who participate in drinking challenges or consume large amounts of alcohol may also be at risk of water toxicity. Certain medicines, such as diuretics, antidepressants, antipsychotics, and drugs such as MDMA or ecstasy, may lead people to use excessive amounts of water as well. Consuming too much water too quickly can lower the sodium levels in the blood. Healthy sodium levels range from 135 to 145 milliequivalents per liter. When sodium levels drop below 135 milliequivalents per liter, it is commonly referred to as hyponatremia. Healthy kidneys can remove excess water at a rate of around 1 liter or 1 quart per hour. Water intoxication occurs when the kidneys are unable to eliminate water fast enough to maintain the normal balance of sodium. At that stage, water will flow into the cells with higher sodium levels, leading to fluid retention. The liquids stored in cells can either cause them to swell or become excessively large. This condition, a primary issue with water intoxication, can lead to brain cell swelling, medically referred to as cerebral edema. Side effects of water intoxication may include difficulty thinking clearly, nausea, and vomiting. It's important to get help early because serious cases can cause seizures or death. During the 2002 Boston Marathon, around 500 runners participated in a study investigating the race-related causes of hyponatremia. Upon completing the race, more than 60 marathon runners suffered from low blood sodium levels due to excessive hydration. To reduce the risks of hyponatremia, researchers recommended that long-distance runners assess their water requirements during a marathon. Before and after workouts, individuals should weigh themselves, consider their hydration level based on fluid loss from sweating, and assess their thirst to determine proper hydration. In another study published online in 2021 by BMJ Open, 590 patient reports were reviewed. The study involved patients with hyponatremia due to water toxicity. On average, patients consumed 8 liters of fluids daily. Severe consequences such as seizures and coma were noted, while other described side effects included vomiting, confusion, and fatigue. Surprisingly, some patients suffered brain damage due to complications, while over 75 patients passed away. On the whole, consuming excessive water, while uncommon, can lead to low sodium levels in the blood and fluid retention. These problems can have a serious impact on the kidneys. Furthermore, it is important to note the risks linked to excessive hydration, as it can result in passing out. Additionally, it's important to understand that kidney damage can also occur due to insufficient water intake. Are you enjoying our video so far? If so, please let us know by liking it, and we'll create more content like this. Drinking too little water. To stay hydrated, it's important to recognize when your body needs more water. Under normal conditions, water loss occurs through sweating, breathing, defecation, and urination. During physical exercise, such as working out, you breathe faster and sweat more. Pregnant or nursing women need additional water intake. Additionally, water requirements may increase if you are in hot weather or at high altitudes. Once you fall ill, you can lose significant amounts of water due to fever, vomiting, or diarrhea. Dehydration occurs when the body loses water faster than it can be replaced. With abundant water available in most regions, people can easily avoid dehydration. Many adults, especially the elderly, are constantly dehydrated. Some older individuals may have weaknesses such as reduced thirst sensation, diabetes, or kidney damage, putting them at risk. Overhydration can lead to an imbalance if you consume excessive amounts of water without an adequate intake of electrolytes. When the body becomes dehydrated, it strives to restore the fluid balance through various mechanisms. Special sensors in the brain, called osmoreceptors, detect fluctuations in the body's liquid and electrolyte balance. The hypothalamus instructs the pituitary gland to release antidiuretic hormone. ADH instructs the kidneys to stop releasing liquid into the urine and instead reabsorb it back into the blood. The kidneys also have a mechanism to compensate for dehydration. When blood pressure decreases, the body releases the hormone renin, triggering a system that raises blood pressure. Renin converts the hormone angiotensin I into angiotensin II. Angiotensin II stimulates the adrenal glands located on the top of the kidneys to release aldosterone. Aldosterone then instructs the kidneys to absorb additional sodium and water. This helps regulate blood pressure and ensures you stay hydrated as well. Insufficient hydration needs to be addressed to prevent long-term kidney damage, even in mild cases. If dehydration persists and becomes severe, it can lead to acute kidney injury, which may occur in as little as 2 days. The low liquid volume also increases the chance of urinary tract infections and kidney stones. Squander items can accumulate in the filtration system or re-enter the bloodstream without being filtered. Fortunately, the hypothalamus also provides signals when it is necessary to consume water. When the body experiences low blood volume, the brain signals thirst and recognizes satisfaction once you drink liquids. However, once you feel thirsty, you are likely already slightly dehydrated. It is advisable to sip water consistently throughout the day and increase intake when you feel thirsty. Elderly individuals and those with brain injuries may experience a decreased sensation of thirst, so it is important for them to make sure they stay adequately hydrated. An extensive 2021 research featured in Clinical and Experimental Nephrology analyzed the water consumption of more than 50,000 individuals from Korea. The results suggested that increasing water intake is essential for preventing kidney damage, especially in older men. As the members increased their water intake in proportion to their body weight, their kidney function showed enhancement. In a study published in 2016 in the American Journal of Physiology, researchers emphasized that dehydration is a significant issue among field experts. The population is experiencing increased rates of chronic kidney disease. The research results indicate that the deaths of many field workers could be connected to ongoing dehydration. Analysts studied various types of liquid intake in dehydrated rats to assess their impact on preventing kidney damage. They found that rats consuming soda had the lowest hydration levels and the most severe kidney damage. Rats that consumed either water or water sweetened with a standard sugar substitute showed slight signs of dehydration. It's crucial to stay hydrated by consuming water instead of soda. The segment focused on water loss and dehydration. Inadequate fluid intake can lead to kidney damage, kidney stones, and urinary tract infections. If you find this information beneficial, remember to like, subscribe, and share for additional knowledge on healing through nutrition. Thank you for watching this video. Stay safe until we meet again. Goodbye.